This medication, Trazodone Hcl, is used to treat depression. It may help to improve your mood, appetite, and energy level as well as decrease anxiety and insomnia related to depression. Trazodone works by helping to restore the balance of a certain natural chemical, serotonin, in the brain. It is usually taken once daily at bedtime, with or without food. The dosage is based on your medical condition and response to treatment. It is important to take this medication exactly as prescribed by your doctor. It may take several weeks before you feel the full benefit of this medication. The optimal timing for taking Trazodone Hcl is at bedtime, as it can cause drowsiness. Before taking Trazodone, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth after a meal or snack as directed by your doctor, usually once or twice daily. If drowsiness is an issue, take it at bedtime. Your doctor will determine the dosage based on your medical condition and response to treatment, starting at a low dose and gradually increasing it to reduce the risk of side effects. Take this medication exactly as prescribed and at the same time each day to help you remember. Do not stop taking this medication without consulting your doctor, as it may cause anxiety, agitation, and trouble sleeping if suddenly stopped. It may take 2 to 4 weeks before you notice the full effects of this medication. Tell your doctor if your condition lasts or gets worse. Common side effects of Trazodone Hcl may include nausea, vomiting, diarrhea, drowsiness, dizziness, tiredness, blurred vision, changes in weight, headache, muscle ache/pain, dry mouth, bad taste in the mouth, stuffy nose, constipation, or change in sexual interest/ability. To relieve dry mouth, you can suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. Remember, your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. However, if you experience shaking, tremors, nightmares, ringing in the ears, problems urinating, blood in urine, signs of infection, shortness of breath, stomach/abdominal pain, chest/jaw/left arm pain, fainting, fast/irregular heartbeat, seizures, eye pain/swelling/redness, widened pupils, vision changes, or a painful or prolonged erection lasting 4 or more hours, seek medical help right away. This medication may increase serotonin and rarely cause a very serious condition called serotonin syndrome/toxicity. If you develop symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, or unusual agitation/restlessness, get medical help immediately. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. And remember, this is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. When it comes to the uses of Trazodone Hcl, it is primarily used to treat depression and other mental/mood disorders. This medication can also help prevent suicidal thoughts and attempts, and provide other important benefits. It's important to note that a small number of people, especially those younger than 25, who take antidepressants may experience worsening depression, other mental/mood symptoms, or suicidal thoughts/attempts. It's crucial to talk to your doctor about the risks and benefits of taking Trazodone Hcl, especially if you are under 25 or if the treatment is not for a mental/mood condition. If you notice any worsening depression or other psychiatric conditions, unusual behavior changes, or other mental/mood changes such as new or worsening anxiety, panic attacks, trouble sleeping, irritability, hostile/angry feelings, impulsive actions, severe restlessness, or very rapid speech, it's important to inform your doctor right away. This is especially important when starting a new antidepressant or when the dose is changed. In terms of daily dosage, the typical starting dose of Trazodone Hcl for adults is 150 mg per day, taken in divided doses. The optimal timing for taking this medication is usually at bedtime, as it can cause drowsiness. However, it's essential to follow the specific instructions given by your doctor. Are you allergic to Trazodone Hcl or nifazodone, or do you have any other allergies? Before taking this medication, it's important to talk to your doctor or pharmacist about any inactive ingredients that may cause allergic reactions or other problems. Additionally, it's crucial to discuss your medical history, especially if you have a personal or family history of bipolar disorder, suicide attempts, heart disease, liver disease, kidney disease, blood pressure problems, or glaucoma. Trazodone may cause dizziness, drowsiness, or blurred vision, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is also important. This medication may also affect the heart rhythm, causing a condition known as QT prolongation, which can result in serious symptoms that require immediate medical attention. The risk of QT prolongation may be increased if you have certain medical conditions or are taking other drugs that may cause QT prolongation. It's important to tell your doctor about all the drugs you take and any existing heart problems. Low levels of potassium or magnesium in the blood may also increase the risk of QT prolongation, especially when combined with certain drugs or conditions such as severe sweating, diarrhea, or vomiting. Discussing the safe use of trazodone with your doctor is important. Older adults may be more sensitive to the side effects of trazodone, especially drowsiness, dizziness, and QT prolongation. During pregnancy, this medication should only be used when clearly needed, and the risks and benefits should be discussed with your doctor. Lastly, it's important to not stop taking this medication unless directed by your doctor, especially if you have untreated mental/mood problems such as depression. If you are planning pregnancy, become pregnant, or think you may be pregnant, it's essential to discuss the benefits and risks of using this medication during pregnancy with your doctor. Additionally, this medication can pass into breast milk, so consulting with your doctor before breastfeeding is important. When taking Trazodone Hcl, it's important to be aware of potential drug interactions that may affect how the medication works or increase the risk of serious side effects. For example, the combination of Trazodone Hcl with certain medications like MAO inhibitors or drugs that increase serotonin levels can lead to dangerous interactions. It's important to talk to your doctor about any other medications or supplements you are taking to avoid these risks. Additionally, some medications can affect the removal of Trazodone Hcl from your body, which may impact its effectiveness. Examples include certain antifungal, HIV protease inhibitors, and antibiotics, among others. It's important to discuss with your doctor if you are taking any of these medications. Furthermore, Trazodone Hcl may cause drowsiness, and taking it with other products that also cause drowsiness, such as alcohol, marijuana, or certain prescription medications, can enhance this effect. Be sure to talk to your doctor or pharmacist about any other products you are using that may cause drowsiness, and always check the labels on all your medicines for ingredients that may have this effect. If you suspect an overdose of Trazodone Hcl and the person is experiencing serious symptoms such as passing out or trouble breathing, it's important to call 911 immediately. Otherwise, you can call a poison control center right away. In the U.S., residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. Symptoms of overdose may include painful/prolonged erection, slow/rapid/irregular heartbeat, unusual drowsiness, unusual dizziness, vomiting, trouble breathing, seizures. It's important not to share Trazodone Hcl with others. Your doctor may also recommend lab or medical tests while you are taking this medication. Make sure to keep all your medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Trazodone Hcl, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next one at the regular time. Don't take a double dose to make up for the missed one. Make sure to store Trazodone Hcl at room temperature, away from light and moisture. It's important to keep it out of reach of children and pets. When it's expired or you no longer need it, be sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, don't flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.